patients with liver failure are among the sickest patients you will ever see in a hospital. And the reason for this is, imagine your body is a bustling city where every organ plays a very vital role. But the liver is like the city's main power station. It detoxifies any harmful substances, it produces proteins essential for clotting blood, and it even helps store energy. So when this power station fails, it's like the entire city gets plunged into darkness, with chaos spreading throughout every neighborhood. For example, when your liver fails, toxins begin to build up in your body because the organ can no longer filter them out. And this can lead to a very severe condition known as hepatic encephalopathy, which is where the brain becomes affected with these toxins and it leads to confusion, memory issues, and even a coma in more severe cases. On top of that, the liver's inability to produce additional vital proteins means your blood can no longer clot properly, which leaves you at risk for severe bleeding if you ever get a cut. And the thing is, each complication leads to another, which sort of leads to these cascading effects, and that's why liver failure is such a critical medical emergency. And when it comes to liver failure, there are two types. There is the acute one, which is the one that happens very suddenly, and there is the chronic one, which is the failure that comes gradually over time. Chronic liver failure can happen as a result of things like getting hepatitis, getting fatty liver, or long-term alcohol abuse. Regardless of the type of liver failure, once the liver starts to fail, it disrupts the balance of the entire body. The good news is there are protective steps you can take to protect your liver and avoid getting to this point. One of the most things that is within your control is to limit excessive alcohol consumption. This is one of the leading causes of liver damage. Your liver works so hard to process alcohol, and when you overdo it, you risk developing conditions like alcoholic hepatitis or liver cirrhosis. Moderation when it comes to alcohol is key. So if you drink responsibly. And if you ever feel at any point that your relationship with alcohol is becoming problematic, then you need to seek help. Another thing that you can control is your diet. You can make sure that you're focusing on eating really good foods like fruits, veggies, lean proteins, and whole grains, and avoid the excessive overconsumption of processed foods and sugars. Another thing you can do is to maintain a healthy weight. Maintaining a healthy weight reduces your risk for developing this condition and other metabolic diseases that can harm your liver over time. If you're somebody who takes a lot of medications and supplements, you need to know that your liver is the organ that metabolizes a lot of these. So when you're taking medications, follow your doctor's instructions. Be very careful with over-the-counter medications and herbal supplements, as some of them can be toxic. If you found this video helpful, give it a thumbs up and subscribe for more health tips. And also share this with somebody whom you don't think is taking very good care of their liver right now. Stay healthy.